In this podcast episode, Triangle Community Foundation Director of Marketing and Communications, Farrell Buckingham, is joined by Jenni Owen from the North Carolina Office of Strategic Partnerships and Ben Money from the Department of Health and Human Services to discuss a year of crisis, what we've learned through nonprofit and philanthropic partnerships. Jenni Owen is Director of the North Carolina Office of Strategic Partnerships. She identifies and launches strategic partnerships between and among state government, universities and colleges, philanthropy, and other entities. The Office of Strategic Partnerships focuses on deepening state government connections with external research experts and increasing agency capacity to conduct and use evidence to improve policy. Ben Money is Deputy Secretary for Health Services at the North Carolina Department of Health and Human Services. His portfolio includes the Division of Public Health, Division of Health Services Regulation, the Office of Minority Health, and the Office of Rural Health. Prior to joining the department in July 2019, he led the North Carolina Community Health Center Association. On behalf of Triangle Community Foundation, we thank our guests for participating, and we hope you enjoy this month's What Matters podcast episode. Thank you both for joining us today. I know that you have very busy schedules, so we really appreciate you both being here, Jenni and Ben. I want to start by reflecting really quickly. So it's hard to believe it's been a year since COVID-19 pandemic arrived in our region, in our state. It went fast and it went slow at the same time. And I think in the beginning, we all sort of shifted and changed our way of thinking so that we could help others quickly. I think there was a real need to make sure that we were helping everyone in our state. And so we know that the state jumped into action as well in lots of ways, but specifically I'm wondering, Jenni, could you tell us what you did in the beginning of this crisis as it relates to the nonprofit ecosystem and the philanthropic need?
Sure. Thanks, Meg. Thanks so much for inviting us to do this, and really appreciate the foundation's role and so much of the work that's going on that's visible and behind the scenes. So just a couple things that I'll offer, and I'm sure Ben has some things to add as well. I would say the first connections we had related to COVID and specific to the philanthropic community and the nonprofit community were lots of questions every day about exactly as you just said, how can we help and what can we do? And for obvious reasons, there wasn't one answer to that. There were many, and they were diverse, and it depends on what your offer is and what you can do and so on. And so what we did early on in the Office of Strategic Partnerships, and this was actually in partnership with the North Carolina Network of Grant Makers and the work they were doing with the sector more broadly, is to put together what we called summary of needs documents. And we weren't advocating or endorsing or making specific requests of funders or nonprofit service providers to do anything, but we wanted to make sure they knew what the asks were, and then they could use that information to make their decision. And so we put together for probably 6 months, more or less frequently, depending on the requests we got, literal specific asks of individual organizations, of statewide networks of organizations, in-state government, with outside of state government, and so on. I'm happy to share more about that if that's helpful. A second thing we did, and this was also, as everything we do is a partnership, we heard many, many examples of universities and colleges struggling to figure out how to support students who had jobs and internships lined up, as is always the case, and all of a sudden those literally just disappeared. The opportunities disappeared. At the same time, we heard, as I was referring to, and again, somewhere else that Ben can probably add to, the nonprofit sector and local government in particular, struggling to fill the capacity needs they had just to do their regular work, not to mention to respond thoroughly, sort of at all, to COVID. And so we were able to very quickly, again, with partners, including the Rural Center, the County Commissioners, League of Municipalities, many colleges and universities, including community colleges across the state, and partnering with Lead for NC, which is an organization out of the School of Government at UNC, to launch something called the North Carolina COVID-19 Student Response Corps that ultimately pays students across the state in about 130 different internships, both remote and otherwise. That really was a testament to partnership, to filling needs. It did not come close to solving all the capacity needs for so many organizations, but I'm excited to say that we're launching that again for the second year, so you'll hear more about that shortly. Ben, do you want to add anything to those two things?
Yeah, thank you, Jenni. And the other thing that we were really involved with at DHHS was just assuring that our nonprofit partners had the resources that they need, particularly early on in the pandemic, with personal protective equipment that they had for healthcare providers, particularly those primary care providers, the resources they needed to utilize telehealth to meet the needs of their patients. We quickly developed emergency policies and protocols, as well as training and technical assistance for healthcare providers to pivot towards utilizing telehealth technologies that really assured that they could maintain healthcare access with their patients while still um, being within a COVID-19 environment in a safe way. So, and the other thing that we recognized was that our nonprofit community needed to have some funding to be able to assist us within communities, and I think that was one of our biggest challenges because, you know, as we know, the wheels of state government sometimes move slowly, and we created several expedited processes by which we could get funds out to organizations, particularly, I think in our case, our Hispanic Latinx organizations that you know, whose members saw a significant impact. They were disproportionately affected by COVID in terms of cases as well as hospitalizations, particularly early on in the pandemic. And so having those organizations in the community resource to be able to help us with messaging, with distribution of personal protective equipment, with getting folks connected with testing as that initiative evolved was really critical to our COVID response.
Meg, I was
Wow.
remiss in not mentioning the survey of nonprofits that I had mentioned to you once in the past. And so if it's helpful, I'll say something about that, but I'll leave that to you.
That's a great segue. So I wanted to say to both of you, that's fantastic and important work, especially Ben, hearing about that partnership and working with nonprofits to get that funding out so that they can do the work. That's really important. And so I appreciate you bringing that up. Jenni, so if you would like to speak a little bit about the survey, I know that the report was released in November, but you spent much of the year working on this survey for nonprofits. So I'd love to hear more about that.
Sure. Thank you for asking. And I meant to mention that earlier. So this also was in response to knowing that so many organizations across the state had a lot to share and may not have had the opportunity to share it in the same way as some of the larger statewide groups, but in addition to those groups as well. And so we partnered with the North Carolina Center for Nonprofits, actually with some support from the Secretary of State's office in helping us reach out to these organizations and others to do a survey. We like to say it's all North Carolina nonprofits. We know there's no way that it actually reached every one of them. But this was a survey that went to over 20,000 organizations. We got over 2,000 responses. And they were literally from all across the state. And we put a lot of energy, so going back to something Ben was saying, put a lot of energy into making sure that we weren't just satisfied with hearing from many, but wanted to make sure we heard from a real diverse cross-section of organizations. So those that are very small in a county that doesn't typically come, literally come to Raleigh to engage because they can't for so many reasons, let alone during COVID, from organizations that cover all sorts of different needs and different populations and subsets of the populations, and went so far as to have people make phone calls to some organizations across the state to make sure, at a minimum, we heard from organizations from every single one of the 100 counties in North Carolina. And so that report, as you mentioned, I think is publicly available. And interestingly, we really committed to making all of the data that came from that report and those responses publicly available. So those 2,000 plus responses and the 3,000 plus text responses, I don't mean text messages, but written responses to questions, are an incredible resource for anyone who might be listening and others to use to search for a county, search for a keyword, search for a issue or a topic or something like that, and use the information from those nonprofit organizations to inform some of the response, even now, even though those responses came in several months ago. The other thing I would say that ties it back to another issue we talked about briefly a minute ago is we asked in that survey, would you be interested in having an intern if somebody could provide one? No commitment, just asking that question. And over 700 of the 2,000 or so respondents said they either would strongly or slightly agree that they would want an intern. And that is largely what fed into then the opportunities for the student response corps, was directly responsive to organizations saying they'd like some support from a student or someone else to help them with capacity. So happy to share more about that, but just want to make sure people know that's an available resource.
Yeah, and I think what's important to mention now for anyone listening is that we will have at the end of this podcast the websites to go to find the information that Ben and Jenni are talking about. So please, at the end, look for that. Jenni, I would love to hear, I know that you mentioned the Student Response Corps is going to continue. If you could tell me, in a few words, what success has looked like in that endeavor for you all and for the students involved.
Sure. I think at the very basic level, success has been more students finding more opportunities in more places, doing more things needed by nonprofits and government partners. So at a very basic level, it's literally matching students to needs. I think a little bit more nuanced would be things like if I'm a student and I have a paid opportunity or an unpaid opportunity, but hopefully paid, that keeps me from doing a 9 to 5 or 8 to 5 Monday through Friday traditional internship. These types of internships and this, I credit the host organizations with this, not us. They came up with ways that students could work at midnight if they wanted to and on their own time. And when I say midnight, my point is just if you are sitting in a particular county that isn't literally in the office of your host organization, or wherever you might be, that didn't get in the way of matching various students with various hosts. So I think this really, despite the sort of crisis theme that we're all focused on, I think this is one of the examples of where employers and students and university partners and college partners trying to place them in opportunities for their career development will be more open-minded about flexibility and opportunities and other ways, to engage people who may not be physically in the same space, but can still provide each other with a lot of support in a challenging time.
Yeah, so important. And we have seen that too at the foundation in being able to collaborate and move forward, working with people in different time zones and different places because we're not restricted by that. So a question, let's shift gears a little and look forward. I know we don't often focus on that, so let's look forward a little. Now that we're a full year into this crisis, I wonder what you're seeing and what is top of mind moving forward.
A year into COVID-19, we're still in pandemic response mode. Fortunately, we're at the phase where vaccines are available, and they're becoming more widely available with the introduction just this weekend of the Johnson & Johnson vaccine. But we still don't have enough vaccine to meet the demand that exists in our state. We are very much focused on assuring that the populations that have had the greatest exposure to COVID-19, as well as the greatest and most severe impact in terms of hospitalizations and death, get access to the vaccine first. And, a big part of our effort has been equitable distribution of the vaccine, as well as equitable administration. So making sure that all 100 counties had access to the vaccine, that they get an allocation each week. But also really assuring that vaccinating providers are administering the vaccine based on the demographics of the communities that they serve. So recognizing that North Carolina is 22% African American, 10% Hispanic Latinx, and a little over 2% American Indian, want to make sure that the vaccines are going into the arms of people that really reflect those demographics and recognizing that they have been disproportionately impacted. We call them historically marginalized populations because of really the history of issues around discrimination, around lack of healthcare access, as well as issues that really are pervasive to their health and economic well-being. We recognize that within this pandemic, they've been disproportionately impacted, and we want to make sure that they have access to the vaccine. And to do that, we're very intentional in terms of how vaccines are allocated, and we're also intentional about holding providers accountable to partnering with community-based organizations, to achieving results of vaccination efforts that meet the demographics or exceed the demographics of historically marginalized populations in the state. One of the things that we know too is early on in our COVID vaccination response, the priority was on speed, getting vaccines in arms as quickly as possible. And what that did was that actually advantaged people that had internet access or had unlimited phone minutes. They could, peruse the internet and find appointments in counties that weren't their home county. They could stay on the phone line to wait for someone to pick up the call. They had transportation that could take them to, places outside of their home jurisdiction to be able to get a vaccine. And so what we saw was, a displacement, if you will, of many local people for others in getting vaccines. And so early on, our percentages were quite skewed in terms of the percentages of people of color actually getting the vaccine. And again, these intentional efforts that DHHS has put into place, as well as funding initiatives like transportation, have made a huge difference in terms of us being able to move the needle towards equity. We're still not there yet. And as we move through our vaccination priority groups, challenges continue to exist. And one of the things that we've done is, as I mentioned earlier, provided financial support and technical assistance to smaller nonprofits. But smaller nonprofits have a real challenge in being able to contract with larger entities like state governments. So I really see this as a huge role for private philanthropy in the state. We've also, and I'm really proud of this initiative, stood up a community health worker program, which utilizes local people on the ground, providing them with training. Many of these folks were unemployed as a result of the pandemic, giving them good paying jobs with training that will tie into a career in healthcare. Right now, they're very active in supporting people with they've been asked to isolate or quarantine, but the majority of them are now pivoting towards supporting vaccination efforts, educating communities, addressing misinformation, encouraging and enrolling people in vaccination appointments, and actually helping them support and host vaccination events. The other thing that they're doing is really being intentional in working with our efforts around addressing social drivers or social determinants of health, such things as food, shelter, household expenses, personal protective equipment, making sure that people are connected with resources on the ground through NC Care 360. And one of the things that we know is those resources are really dependent upon private philanthropy in supporting local efforts such as food banks and housing and shelter support services. Those things are so important. And that's just pandemic response. As we move into pandemic recovery, one of the things that we're already seeing is just an increase in mental health issues, such as depression and substance abuse. Also, interpersonal violence. We know that digital divide has created educational declines, as well as caused a tremendous hardship in our communities. So there's going to be a huge need for financial recovery, small business supports, and really efforts to take North Carolina, not just to where we were, because the status quo didn't work for a lot of people, but to a new approach towards how we can have an equitable system from the standpoint of health as well as economics that works for all North Carolinians.
Wow, so much to unpack, and I feel like so much that we're all thinking about, right? But really struggling with how to do it all, right? And so you make some really important points there. Jenni, anything to add to that question? Ways that let's move a little forward and say, what are ways that donors, residents of North Carolina, nonprofit leaders, people listening, how can they jump in and help with some of these initiatives?
No, thanks for asking that. And I just want to reiterate what Ben said. The status quo didn't work for a lot of people. I think we just need to say that over and over and over again. So, I agree, right? Personally, professionally, whatever. I don't want to go sort of back to, what was normal, since that was not what most, so many people needed, wanted, and, we can do better, and we're doing better now. So let's keep that going. And we're doing better in a lot of ways. And I would really just highlight again, not to continue to say just, partnership, but I think so many partnerships have both been forced upon us during this time, as well as, we've sought, when I say we, all of us have sought them proactively. And my real hope is that we don't retreat and say, oh, well, Ben, nice knowing you during COVID, but now we don't need each other anymore. So, good luck, right? But on the contrary, to say, wow, look at how much we were attending to research and data to inform decision making. And look at when we really needed to, we called on partners and they called on us in different ways. And look at who suddenly was able to find time. I don't mean an individual, but organizationally, individuals too, to pursue something that we hadn't pursued before. And so my, hope is that we don't, not just in the sort of status quo way that Ben meant it, but of course that too for individuals, but really look at why did the partnerships that came out of this and are happening right now, like why did that happen, and why, all the different ways that we don't have to let that go and can keep them going. And I do mean, one of the things that we infuse in all of our work, and I know this is true for HHS right now as well, is using research and evidence and data to inform decision making. And it's not easy often, it's not always exactly right. It doesn't necessarily lead to decisions that some people might want to see happen. But we can always fall back on and highlight, this is why we did what we did. It's because of research and information from real people. I mean, I would really add, yes, research, yes, data, but don't discount that on the ground, when I say real people, potentially not traditionally data-driven information. I think that really matters too. So I don't want to discount that at all. On the contrary, I want to hold it up. And philanthropy, I think, are some of our philanthropy partners, and philanthropy across the state and nation and world are some of those that really do best and are doing that increasingly as well. And so to look at the data that we and others are providing, whether it's from a traditional research partner or not, for example, that survey, philanthropic partners can look there, right? Look for what you want to fund, for example, if that's what you're doing, and see where your funding might be able to meet specific needs that you weren't necessarily aware of prior. So as you said, a lot more to say here, Meg, but those are a few things that I would emphasize as we look ahead.
Great. And how about you, Ben? What would you want to say? You have the platform. What do you want to say to our donors, our nonprofit leaders listening? How can they help you in doing what you're trying to do across the state?
Yeah, so it's been so critical for us to be able to work with grassroots community organizations and getting the message out about COVID, how to protect and prevent the transmission of the disease early on. We're really focused on the 3 W's, as we still are, because it is, along with vaccines, our number one strategy for preventing the spread of the pandemic. And our small organizations have been really, really critical. Without philanthropic support for them, I think it would have been very difficult for us to be able to get that message conveyed across the state. I think going forward, one of the things that we need to really focus on is what that new normal looks like, what we want it to look like. I think it's going to be important that we really focus on overcoming systemic inequities and the historic practices that have roots in systemic racism that left our communities vulnerable. What we hear a lot is COVID exposed the cracks. Well, COVID really exposed the chasms that exist and made vulnerable communities even more vulnerable. And coming out of this pandemic, we'll even see greater economic decline, educational declines, social structures that have been severed. So those fissures that exist have really created huge chasms. One of the things that we know is it's going to be important to have educational opportunities, and not debt-ridden educational opportunities, but educational opportunities that lead to jobs, that lead to careers, that lead to systemic change. Also, small business capital. It's going to be really important that we infuse our small businesses to get up and running. And home ownership programs, the greatest way of having wealth creation. And we certainly know that wealth and health are intricately tied. And there's a lot of discussion right now around criminal justice reform. So critical. An encounter with the criminal justice system in a negative way can ruin your life. And we've seen that happen. So it's going to be important that we have community development initiatives for historically marginalized populations, and not just for venture capitalists. I mean, so often we hear about these, initiatives are really about community revitalization, and really it's about putting money into the hands of capitalists to make money in areas where poor people once lived and then they become displaced. Also, we need to consider opportunities that will be existing and exist now that need to be further incentivized in the clean energy economy. I'm talking about wind and solar that is so prolific here in North Carolina that needs to be fully maximized. These can create new jobs, new investments, and what this could mean for rural North Carolina is huge. And so, really thinking about how communities of color could benefit, leading to wealth creation, and really sort of changing the generational destiny of so many in our state. So, I think there's a lot of opportunity, but we're going to have to be very intentional about our efforts moving forward.
I think so well said. I think that the evidence for this private public philanthropic partnership to continue and move forward, and to piggyback on something both of you have said, to not go back to the way, but consider these challenges opportunities to move forward in a new way, and involving everyone in these decisions, as you said, Ben. So I guess we'll finalize our talk there, and I'll ask one final question to both of you. So as you look to the future, what are you two most happy about? Jenni, I'll let you go first.
I'm sorry, Meg, did you say what are we happy about? No.
Hopeful about.
Hopeful about. Okay. Yeah. Well, I would say, honestly, back to what we both said, and I really appreciate how Ben said it just a minute ago. I mean, I'm hopeful that we can do a lot of, or make progress on a lot of what we were both identifying is, narrowing those chasms, removing some of the narrowest chasms, and narrowing some of the widest chasms. And I mean that seriously. I think to continue to always really almost have a checklist until it becomes natural, because it's not natural now. So hopefully it will be someday. But have a checklist if that's what people need, or that's what organizations need. But say, well, wait a second. Have we consulted with, or have we used the expertise of, or have we, you can fill in the blank. So we're not just defaulting to sort of the easier, not easy necessarily, but the easier way of engaging different types of partners, even in the same sector. So Ben made a reference to small organizations. So whether it's small, whether it's organizations serving people of color, or people with different types of challenges, to really reach deeply into those places and people and communities and resources with expertise. And that would include philanthropy, right? So Triangle Community Foundation is a large philanthropic entity in the Triangle area, obviously. I have in my recent work been making sure not to forget about very, very small community foundations that may only serve one county, that also have, in a rural part of North Carolina, for example, and making sure that they have a lot, or making sure that we recognize and take advantage of all that they have to offer and inform. And a quick, if I may, plug isn't quite the right word, but a highlight that just one business day ago, so on Friday, started in state government for the first time, and we think the first time nationally, is someone in the role of what we call a philanthropy liaison. So that is a role that is situated in state government to serve state government and philanthropy. The person is Joy Vermillion Heinsohn, who comes from the Z. Smith Reynolds Foundation. So she is now with us. I'm very happy to have her on board, and especially appreciative of the nonprofits, with the philanthropy partners and partners within state government, and universities who help to conceive of this and make it happen. So that's really, to be very specific, that is demonstrating philanthropy's commitment to helping to work on some of these things and push them forward. And thank you, Meg. If we're wrapping up, I know Ben has a couple more words to say, I think, but if we're wrapping up, thank you for giving us this opportunity to talk about some really important questions and challenges.
Ben,
thank you, Jenni.
Yeah,
I think that there's a clear recognition that Band-Aid solutions won't work. Not for our health and social service structure, nor for our efforts to mitigate climate change. Our solutions really need to be focused on tackling the root causes of inequity. I'm hopeful because people are becoming willing to have these difficult conversations about the faults in our society, born out of human exploitation, racism, and division. And philanthropic organizations can be a catalyst for these difficult conversations and this very difficult work, particularly in areas that government and businesses are often reticent to tread into. So I'm hopeful that philanthropy can really be a catalyst in this way. to assure that we can keep this work going forward so that this becomes a movement rather than just a moment. We need to leverage this crisis of COVID-19 and really take advantage of it as an opportunity to see systemic change throughout our nation and North Carolina. And Meg, thank you so much for the opportunity to have this conversation today.
Of course, well said. Thank you both very, very much for being here, for doing this with us, and for your partnership and work in the state in the last year and previously and going forward. I'm hopeful. I know the foundation is hopeful that we will spend the next year focused on recovery, healing, and real change. And I think it's really uplifting to hear both of you say that too. So thank you so much.
Thank you.
Thanks,
We invite you to visit the websites listed on the screen if you are interested in learning more about and supporting the work Jenni and Ben are doing in our state. Want to join us in collectively supporting the pressing needs of the Triangle today? Visit our website to learn about the Fund for the Triangle to become a catalyst for change today.